Hi, I'm Dr. Susanne Tanski. I'm the Section Chief and Vice Chair of General Pediatrics and a practicing pediatrician here at Dartmouth-Hitchcock Medical Center and the Children's Hospital at Dartmouth. And I'm so excited to be here with you today to talk about COVID-19 vaccines for our 5 to 11-year-olds. This was approved by CDC just yesterday, and we're so excited to be able to make this vaccine available to you and your loved ones. We have lots of parents who have lots of questions about this vaccine, and we really want to make sure we can answer all of them. I will do my very best. I have some notes in front of me, so when you see me looking down, I'm just making sure I see what questions have been brought in, and let's get started. To start off with, we're really excited as an entire hospital system to get your children vaccinated as quickly as possible, but we do need some patience. We don't have the vaccine in our hands yet, and that's going to take a little bit of time so that we can get it in all of our practices and make sure that we get it to all of your kids. So we will be having some large events, and those events are going to start across the Dartmouth-Hitchcock system on November 13th. The website that you guys can look at is go.d-h.org/vaccine. That's go.d-h.org/vaccine. That is the place where you're going to be having the up-to-the-minute information about when you can schedule vaccines, where they will be, and what the schedule will look like. We're going to be doing our very best to make sure we have as much access as possible, and we'll put all of that information right in there. As you all know, we're on Facebook Live, so if you have any questions, I'd like you to please type them in the chat, or you can email them to social@hitchcock.org. So as I mentioned, in anticipation of this big vaccine that was approved just yesterday, we've been working really diligently to try to get all of these vaccines scheduled. Here's our current information. November 13th will be the first date. In the Upper Valley, we're prepared to vaccinate around 3,000 kids in 3 different locations. The first location will be at Dartmouth-Hitchcock Medical Center. The second will be a collaborative with our regional public health networks at the Lebanon High School. And the third will be at Alice Peck Day. If you are a Dartmouth-Hitchcock patient, that can be a primary care patient or a specialty patient. If you're a CHaD kid of any kind, you can register through MyDH. That link will go live probably within 24 to 48 hours. If you go on now, it's not yet available. Please be patient. We're working as quickly as we can to get that scheduled. For the location at Lebanon High School, information at that previous website with our godh.org/vaccine will also provide you the information with how you can sign up for that. That is a public clinic. It doesn't matter if you have any affiliation with Dartmouth-Hitchcock, but the important thing to know if you're going to go to a large public site like that is it is kind of gymnasium style, and so you have to know your kid. Is your child going to do okay in a big room with lots of other people, or will your child need a door of their own and something a little bit more quiet? A couple of professional tips for when you're bringing your child to any vaccine location. Please make sure your child is wearing a short-sleeved shirt or a tank top so that it's not very tricky to get them in and out of their clothes. You'd be remarkably surprised at how complicated it gets to get kids out of their clothes. But as a pediatrician, I can tell you, that's a pretty tough sticking point for some kids. Alice Peck Day is also conducting their clinic. That will also be on November 13th from 8 to noon in their multi-specialty clinic, and that also will be scheduled through MyDH. We do believe that registration for appointments for all of these events will be within the next couple of days, but again, please stay tuned to that website. All of these efforts, and not only in the Upper Valley, but across Dartmouth-Hitchcock, Manchester, Cheshire, Keene, Nashua, Concord, all of these locations are putting forth huge efforts, which are collaborations between the doctors, the nurses, the medical assistants, the secretaries, medical students, residents, fellows, you name it. We've got everyone, all hands on deck to try to make this go as smoothly and quickly as possible. After the 13th, we are doing our best to make programs available in drive-thrus or evening hours so that if you can't make the 13th, we're not missing anything. There's going to be plenty of opportunities through Dartmouth-Hitchcock and CHaD going forward. I will also note that All of our pharmacies, many of our pharmacies in the community are also providing vaccine, and some of them actually are making appointments already. And I would encourage, we need our pharmacist partners to help us with this because there's a lot of kids to vaccinate, and we want to get them vaccinated and protected as quickly as possible. So you can absolutely go online and try to sign up at any of the local pharmacies that are local to you that might be able to schedule your child sooner than even the 13th. Please take advantage of any opportunity to get your child vaccinated. So now let's talk a little bit more in depth about the vaccine itself. We've got lots of questions, and for some parents, this is a really difficult decision because there's been a lot of disinformation and misinformation and rumor, and I'm going to do my best to try to make this very straightforward about what the science tells us and what Pfizer did to study this vaccine to show that it is safe and effective for our little kids. So what they did is they've been working on this vaccine, as you all know, for about 18 months for adults and maybe 6 to 9 months for kids. The first thing they did was figure out what's the right dose for our little people. Is it the same dose that I got as an adult, or will they be fine with a smaller dose? And they experimented with those doses, and they found that a 10 microgram dose of the Pfizer vaccine works just as well as the 30 microgram dose that I got as an adult, and that as our 12 and up kids got. They did some really neat studies where they found out, looking at blood samples, that the amount of antibody in children's blood between 5 and 11-year-olds who got the 10 microgram dose was equivalent to that of the 16 to 25-year-olds. So again, that means that the small dose in a 5 to 11-year-old works just as well as a 3 times bigger dose in a 16 to 25-year-old. This doesn't have anything to do with how big you are. It really has to do with how many trips around the sun you've had. It's about your immune system. A younger immune system is really more robust than an older immune system. You develop something called adaptive immunity while you're living your life and coming in contact with all the scrapes, bruises, and colds that we get in our lifetime. And a younger immune system often responds much better than an older immune system. So this is good. A smaller dose of the vaccine also leads to fewer side effects. And that's obviously one of the things we want to make sure we're taking care of. Fewer side effects mean happier kids. So right now, the only vaccine that's been approved for 5 to 11-year-olds is the Pfizer vaccine at the 10 microgram dose. An important thing to note, though, is that this is actually a different vaccine. It comes in a different bottle, and it comes with it. There's slightly different characteristics about the vaccine itself. So we can't just take the vaccine we have on the shelf, take a smaller amount, and put it in your child's arm. We need to make sure we've got the proper vaccine in the proper vial with the proper smaller syringes that are being made available for this vaccine. So again, we need a little bit of patience so that we can get all of this in place. We do expect that there will be additional vaccines available for 5 to 11-year-olds. The Moderna vaccine is currently under study as well. And so that we might have some good news about that vaccine as well in the coming months. But for now, it's just this one kind of vaccine. So Pfizer explored this vaccine in about 3,000 kids. And with the first group of 1,500 kids, we have longer data. And with the second group of 1,500 kids, we've got a little bit shorter period data, but we have enough data to really understand how safe this is on our 5 to 11-year-olds. So the first thing that had to happen is the Food and Drug Administration had to look at all of the data from Pfizer. FDA approved this vaccine and sent it on for their recommendation last week. And then just yesterday, the Advisory Committee on Immunization Practices, which advises the CDC, they met all day long, reviewed the same data, and made a unanimous decision that this vaccine is safe and effective in our young people. So how effective is it? Well, we found there was 91% fewer cases of COVID in the vaccinated group. And that was symptomatic COVID cases. In all the kids who received active vaccine, there was not a single case of severe COVID and not a single case of hospitalization. In addition, there was not a single case of anaphylaxis, which is one of those immediate severe allergic reactions that can happen. And it didn't happen at all in this age group. And they followed the kids out and found there was not a single case or hint of myocarditis. Myocarditis is an inflammation of the heart muscle, and we saw cases of vaccine-related myocarditis from the Pfizer vaccine in older male adolescents. So this is really exciting news. But I will also note that this myocarditis is a very rare side effect on the order of just a few per every million doses. And so with only 3,000 kids, we can't say there's zero risk in the future of seeing a signal for myocarditis, but this is very encouraging. So I was very excited to see that. So as noted, this is under emergency use authorization, and this vaccine is under, we call it EUA, as is this vaccine for the 12 to 15-year-olds. This vaccine is fully approved for 16 and up, and Moderna is still under EAU for adults, and Johnson & Johnson is still under EAU for adults as well. So what other differences do we have between this vaccine and others? As I mentioned, this is 1/3 the dose. It is smaller needles, and it has been able to show us that there's some fewer side effects because of that lower dose. This will still be a 2-shot series, 21 days apart, so that hasn't changed. If you go a little bit longer, that's perfectly fine. You don't need to restart your vaccine series or anything else, but the recommendation is at least 21 days apart. So I have a first question, an emailed question. This is, my 10-year-old is very excited to get the vaccine. So is mine. What side effects can she expect and how severe will they be? And how can I best explain to her what to expect in a way that won't be scary or overwhelming? Great question. So the first thing you can expect is this is really just like most other shots that we get. And for many of you who've already had this vaccine, you know that the vaccine administration itself is pretty much like a flu shot. Doesn't hurt so badly, just a pinch, takes just seconds, and away you go. Every child, just like every adult, after they get their vaccine, is going to be observed for 15 minutes, just in an abundance of caution to make sure that no one has any side effects that we need to see right away. So you'll have your vaccine, and then you're going to be watched for about 15 minutes. Hopefully we'll make it fun, and there'll be some fun things for you to do while you're waiting. The typical things we see within the first couple of days are also things we see with other vaccines like the tetanus booster. Your arm may be sore, maybe a little bit red, maybe a little bit swollen. You might have a little bit of fever or chills or a headache or fatigue. Those are all really common things we see with many of our childhood vaccines. And we know that the kids in this study had fewer side effects and reported lower levels of these really mild side effects as compared to some of our adults as well. So again, arm soreness, known, that's pretty common, and then fever, fatigue, chills, and maybe some muscle aches as well. As for long-term side effects, that's the next question that often comes up. In all of our history of doing vaccines in the United States and elsewhere with vaccine production and administration, we've not seen long-term side effects in any vaccine outside of about 8 weeks, 2 months. So there really is no suggestion or reason for us to assume that this particular vaccine would have any long-term side effects when we've never seen this again with any previous vaccine program. And we've given millions and millions and millions of doses in the United States over the past 15 months or so. The bulk of our vaccination has been within the last 11 months, but from the original Pfizer studies, we've got some good information, and we haven't seen anything long-term other than protection against COVID disease. Vaccine ingredients as injected into our body go away very quickly. They're broken down by our bodies very quickly, so they don't hang around very long. And so all the effects that we see are your immune system revving up so that they can fight off the germ that would make you sick if you saw it in real life in the future. So another question, my child is about to turn 12. Which COVID vaccine should they get? I would suggest as a pediatrician, get the vaccine that's available to you soonest. As I mentioned, the dose is not dependent on your size. It really is age dependent. So if your kiddo is 11 and your kiddo is ready to get their vaccine, go ahead and get that youth dose of the 10 microgram Pfizer vaccine. And if your child has already turned 12, go ahead and get that approved 30 microgram dose for your 12-year-old. What they did in the study is if a kid had their birthday, they continued to give that 10 microgram dose. So 12-year-olds received that 10 microgram dose as they had their birthday. And they had, again, that same immune response because those younger immune systems just do such a terrific job. Another question that's come up and has been in a lot of social media is whether or not a COVID-19 vaccine can affect your fertility. And there is no evidence whatsoever that a COVID-19 vaccine can affect your fertility. CDC has followed tens of thousands of women, and many of those women have become pregnant and have had successful and healthy pregnancies. And we know that COVID disease during pregnancy can be very severe. So we really want to protect everyone, and we want to make sure that our young people feel confident getting their vaccines, and we get our pregnant moms vaccinated as well to make sure we've got healthy babies. So another question, if kids are less likely to have severe COVID-19 disease, why would we bother getting them vaccinated? There's a lot more to this than just death. Kids aren't supposed to die from respiratory illnesses. Kids aren't supposed to die at all. So we really want to protect our kids and give them the best protection we can from this vaccine. So in the United States, we know that we've had around 700 children die from COVID disease in the last 18 months or so. 94 of those children were between the ages of 5 and 11. And most of those deaths would be preventable by this vaccine, because we know that in young people who get this vaccine, they are much less likely to have severe disease and any hospitalizations. So this is a really good piece of information. And it's more than just hospitalizations and death. If a kid has COVID-19, they might have a mild cold, relatively mild illness, but that keeps them out of school for the entire quarantine period, because we need to try to prevent transmission as well. So they're missing school, they're missing their friends, and we know that kids can transmit this disease. So if they have COVID disease, they're at risk to give this to their loved ones. And if they're with anybody in their family who has immunocompromised or the elderly, we know that that's a concern. So being vaccinated reduces the risk of disease, reduces the risk of transmission, keeps our kids in school, keeps our kids playing, and keeps our whole communities healthier and safer. Some questions have been raised about multi-inflammatory syndrome, which is also known as MISC-C, and there have been no cases of MISC-C associated with any of the vaccine programs to date, which is super reassuring. MISC-C is a disease that has been a effect from COVID infection, and it can happen several weeks after the actual infection from COVID. And so again, if we prevent disease with our vaccines, we will be able to prevent MISC-C. Other people have asked whether or not this would prevent long COVID. And again, if we're preventing the disease in the first place, we should be able to prevent long COVID symptoms, which are those persistent feelings of fatigue and respiratory symptoms and not having energy and things of that nature. Okay, another question. If my child is fully vaccinated, does that mean they can start taking off their mask in certain situations, especially with the holidays coming up? Well, for sure, that's what we're aiming for. We would really like to remove our masks and be able to smile at each other again and be mask-free. However, for the moment, until we get as many kids vaccinated as possible, the CDC is continuing to recommend that we wear our masks indoors, and we wear our masks whenever we're in locations, especially where there's high levels of circulating virus. So we do want to keep our masks on just for a little bit longer. But indeed, that's the goal, is that this vaccine will help us to become mask-free. Another question that's just popped up. Should I allow my child to have a say in whether or not they want this vaccine, or are they too young to weigh all the information? Should this be an adults-only medical decision? This is a tricky one, and this is really going to depend on your family. If your family already asks your child about their vaccines that they normally get, then this might be a very logical conversation for your family. I know in my family, if I asked my kid when she was 4, would you like your vaccines today? She would have said no. She's pretty excited about vaccines now because she knows they can keep her safe. But for a lot of kids, the idea of a shot is pretty scary just for the shot itself. So you have to rely on your own family constellation to figure out whether that's the right conversation or not. I think the conversations we need to have with our kids are that this is a vaccine that teaches your body how to respond, so that if you come in contact with this germ, your body will already know what to do to fight it off as quickly as possible. And I do think that all of us are going to come in contact with this with this illness. COVID continues to be pandemic. It continues to be around the world. It continues to be in our communities. So it's likely that all of us will come in contact with it. So we should all have the best protection we should have, which is vaccines. Okay, we're getting a few more questions about kids who are different sizes, either being big or small for their age, and it doesn't matter. So whether you've got a really giant 5-year-old or a really tiny 5-year-old, the dose is still the same. It's not related to weight. It's related to, again, how old you are, and that's related to your immune system and how well your immune system works with this vaccine. Great question. Okay, other questions. How long after getting the COVID-19 vaccine can you get other vaccines? CDC just provided guidance on this, I think overnight. So this is brand new. There is no interval that's required between COVID vaccine and anything else. So you can get your COVID on your left arm and your flu vaccine on your right arm, and that is going to be safe. That's what they've been saying for adults, and that's the practice that adults have been using. And so this is actually really good news for us that we don't have to delay or separate things. I have a lot of kids who are still in the midst of getting their flu vaccine, and I wouldn't want them to delay their COVID protection because they got a flu vaccine last week. Let's get them protected against everything. Will my child require a booster shot? We don't know yet. So at this time, a booster shot for kids is not recommended. I expect that the CDC is going to continue to follow and collect information and data to find out whether or not our young people are going to need this as well. I will say kids have pretty awesome immune systems, though. Okay, so I'm waiting for some more questions to come up. I'm going to wait for things to be fed to me and see if we have any other questions. We're getting to the end point. We've only got a few minutes left. I'll just remind everyone that the places where we need to go for our vaccine information, it's go.d-h.org/vaccine. And again, for anyone going to any vaccine location, make sure your kid is prepared with a short sleeve shirt. They can wear their hoodie on top, but maybe before you get into the room, take the hoodie off so we've got quick access to those arms where we can give that vaccine. Just looking at my screen here to see if there's more questions that have been added. Oh, great question. New question. Oh, if my child was a preemie or has a chronic condition like asthma, should we delay the COVID vaccine? No. There is no contraindication for previous medical conditions for the COVID vaccine. And we really want to make sure that your medically complex child is protected as quickly as possible so that they can get back to being a kid just like we want them to be. The only concerns about the COVID vaccine are if you have an allergy to PEG, polyethylene glycol, which is something that's in the vaccine. And if you have an allergy to PEG or if you've had a severe anaphylactic reaction to any vaccine in the past, please have a conversation with your pediatrician because we might be referring you to allergy clinic to make sure that we can check and make sure that this is completely safe for you. For almost everyone, though, this is a very safe vaccine. I've got a cue here that another question's coming up. Keep them coming, folks. It's conversation. One of the things that other people have asked me about is how this vaccine compares to other vaccines that we give. And a good comparison is chickenpox vaccine. So chickenpox vaccine came out after I was a kid. It came out in the 1990s. And before that vaccine was on the scene, somewhere around 16 children between the ages of 5 and 9 would die of chickenpox every single year. It was about 100 children under the age of 18. And those were, again, preventable deaths. Now that we're up to 95% vaccination for chickenpox, most of my residents haven't even seen chickenpox, and we don't have those kids having severe chickenpox disease. In contrast, as I mentioned, there have been many more deaths from COVID, even in this young and healthy age group. So this is just a good comparison for why COVID vaccination is so important for our kids. Okay, next question. If I have questions about vaccine, should I make an appointment with my child's primary care provider, or is there a different place to contact? That's a great question. If you are a Dartmouth-Hitchcock patient, you can sign up through MyDH. That's our web portal. If you are not yet signed up for MyDH, I strongly encourage you to sign up for MyDH. It's really simple. MyDH.org. You can put your information in there, get yourself into our portal, and that will be the fastest way for you to schedule that vaccine. If you have another provider, you can call your pediatric practice and find out what they may be doing. But know, too, that there's many other opportunities in our local pharmacies, in some of these regional public health network productions, including the one that will be at Lebanon High School on November 13th. And just another point, since we need another dose 21 days after, there are events that are scheduled 21 to 22 days after these large events, so everyone can get their vaccine on the right schedule. I'm going to look and see if there's any additional questions. Couple notes, if you did not have an opportunity to sign in at the very beginning of this Facebook Live, this will be archived here on Facebook and as well on our DH YouTube channel. And so just to wrap up, if you have additional questions, you can send them in and we can try to get those questions answered. We do have some vaccine information on chadkids.org. And so we'll add to our frequently asked questions so that if people have specific things, they can look there. I'll remind you that you can go to dh.org/vaccines. And again, our first clinics will be starting on November 13th. Thank you so much for joining me today and for being part of this conversation. I am so excited that we can vaccinate our kids. This is a tremendous opportunity and an amazing advance of science to get us here. I'm really happy to be vaccinating my kid, to keep her safe, to keep the immunocompromised people in my family safe, to keep our elderly grandparents safe, and keep our community safe. Thank you so much for your time.